Good day friends, I'm Dr. A.S.K. Gupta and I'm going to talk to you about intrauterine death in a patient around 30 weeks of gestation. She is a young lady who has already delivered 2 normal kids, but she's 30 weeks of gestation. She is not a known diabetic and she has come to us for the ultrasound examination. And on the examination it has been found that the baby or the fetus has already expired. What are the features of the IUD in a patient? And it appears that it is relatively a fresh IUD. So you can see that there is no liquor into the uterus, and the entire uterus is literally free from liquor. There is no liquor here. You can see that we are scanning all through, but we cannot find any liquor. Secondly, the bones are not degenerated, but if you see the intra-abdominal parts, you find that they are degenerated and hypoechoic, and they have the heart is not beating. This is the thorax and this is the heart, and the lungs are normal. They have not yet degenerated. Usually the lungs will also accumulate fluid over the time and they will get degenerated, but this is relatively fresh IUD, not very fresh, but it is pretty some time, but not more than 6 to 12 hours that the IUD has occurred. And this patient is not a known diabetic, but she should be investigated further. You can see that the os is closed. Even in a case of IUD, the position of the os, the size of the os and the presentation are important, because these patients are to be delivered vaginally or by the cesarean section. The decision is to be made by the obstetrician or the gynecologist, so this should be reported. Again, you can see that abdominal organs and the heart. This is the heart. You can see this is the conical heart, and this is the abdominal organs. Abdominal organs are all hypoechoic, degenerated, and the heart is not having any cardiac activity. So this is a case of intrauterine death around 30 weeks of gestation. Here this is the skull, and you can see that there is no Spalding sign present in the skull. Though there can be some hypoechoic contents in the brain, but as the brain shrinks much more, the bones are going to overlap and develop a Spalding sign. But as of now, there is no Spalding sign. So it means that this patient is having a relatively fresh IUD, and this should be reported. In case you are convinced and you like our video, please do subscribe to our channel. Do not forget to press the like button and share the video with your friends. Thank you so much.